Understanding bloat, gastric dilatation-volvulus, and Great Dane's prevention and management of bloat and Great Dane's bloat, also known as gastric dilatation-volvulus, GDV, is a serious and potentially life-threatening condition that commonly affects Great Danes. This condition occurs when the stomach becomes distended and twisted, trapping gas and causing a decreased blood supply to vital organs. It is crucial for Great Dane owners to be aware of the signs, prevention, and management of bloat to protect their beloved pets. One of the main factors that contribute to the development of bloat in Great Danes is their deep-chested conformation. The deep chest allows the stomach to have more room to move, making it more prone to twisting. Additionally, factors such as rapid eating, exercising immediately before or after meals, and consuming large meals can further increase the risk of bloat in these dogs. Recognizing the symptoms of bloat is essential for early intervention. Great Danes with bloat may exhibit signs such as a distended abdomen, unsuccessful attempts to vomit, restlessness, excessive salivation, rapid breathing, and a weak pulse. If you notice any of these symptoms, it is crucial to seek immediate veterinary attention as bloat can rapidly progress and become life-threatening. Preventing bloat in Great Danes involves several strategies. One of the most important steps is to avoid feeding your dog one large meal a day. Instead, divide their daily food intake into several smaller meals. This helps to reduce the volume of the stomach contents and decreases the chances of it becoming distended. You should also ensure that your Great Dane eats at a slower pace. This can be achieved by using puzzle feeders or placing large objects, such as a tennis ball, in the food bowl to slow down their eating. Exercise should be avoided immediately before and after meals, as vigorous activity can contribute to bloat. Instead, schedule exercise sessions for at least an hour before or after mealtime. It is also beneficial to monitor your Great Dane's water intake. While it is essential to keep them hydrated, excessive drinking immediately before or after a meal can increase the risk of bloat. Thus, it is advisable to limit their water access during this time. If your Great Dane is at a higher risk for bloat, your veterinarian may suggest a procedure called gastropexy. This surgical procedure involves attaching the stomach to the abdominal wall, preventing it from twisting. Gastropexy can be performed as a preventative measure during a spay or neuter surgery or as an emergency procedure if bloat occurs. Research has shown that gastropexy significantly reduces the risk of bloat in predisposed breeds like Great Danes. In addition to prevention, it is crucial to know how to manage bloat in case it occurs. If you suspect your Great Dane is experiencing bloat, contact your veterinarian immediately. Time is of the essence in treating this condition. While you wait for veterinary care, you can try to relieve some of the discomfort by gently massaging the dog's abdomen. However, it is essential to avoid putting pressure on the stomach as it may worsen the condition. Upon arrival at the veterinary clinic, the veterinarian will conduct a thorough examination to confirm the diagnosis. Treatment typically involves decompressing the stomach by passing a tube down the esophagus or using a needle to release the trapped gas. In more severe cases, surgery may be necessary to untwist the stomach and remove any damaged tissue. In conclusion, bloat is a serious condition that Great Dane owners should educate themselves about. By understanding the risk factors, recognizing the symptoms, and implementing preventive measures such as dividing meals, feeding at a slower pace, and avoiding intensive exercise, the chances of bloat can be significantly reduced. Additionally, considering gastropexy as a preventative measure can provide extra protection for your Great Dane. Lastly, knowing how to manage the condition and seeking veterinary care immediately can improve the chances of a successful outcome if bloat does occur.